respiratory therapists, what we do, every day we see patients on the floor with COPD, asthma, so that comes from children, so like babies all the way up to 90-year-old people or older. We deal with their COPD, so we give them breathing treatments, we deal with their asthma, we mess with critical patients with ventilators, we deal with our ER patients, so we have a lot of like traumas coming in that we deal with, help getting the patient on a ventilator, help get them intubated, get them stable. Whatever we need to do, we're there with the physician's hands-on, making sure they're stable enough for whatever we can do.
Yeah, Brandy covered most of it. If you're in the hospital at some point or a time or another, you're probably going to see a respiratory therapist for something. For me, although this was a career change for me, I didn't go back to school for respiratory until I was in my late 20s. I was an athletic trainer prior to that, but I wanted to do something kind of more upbeat in the hospital and decided nursing wasn't for me, so respiratory was a good fit. In my previous career, I worked a lot of days, so I was paid salary. I worked a lot of days. I was having kids and wanted to move to a career where I have a little bit more freedom at home and still get paid pretty well. And that was also interesting in healthcare in some fashion. I went back to school at Ivy Tech. It was a 2-year program. It took me a little bit less time because I had a previous degree, but it took me about 1.5 years to get my degree.
What I like about my job is that it's a fast-paced job. You can work in a critical setting or you can work in more of a laid-back setting, but my favorite is the critical part, and it's more hands-on every time. It's from 6A to 6P, 12-hour shifts. You have the next day off usually, and I just love the flexibility of my schedule. Come see us at our open house and find out more why you would like to be a respiratory therapist.